Well, thank you, Mr. Speaker. It's an honour to be here representing the wonderful people of Calgary-Glenmore. One thing that we can all agree on as elected representatives is that we need to stay in touch with those and listen to those people we represent. Mr. Speaker, thousands of Albertans across this province want to send the Premier a message about his healthcare superboard. Healthcare must be patient-centred, not government-centred, and the Premier's superboard puts bureaucrats in charge. Albertans want medical professionals in charge that understand their needs as patients. Will the Minister of Health listen to Albertans and return healthcare decision-making to local communities?
The Honourable Minister.
Well, Mr. Speaker, I'll just take one member of the Alberta Health Services Board who is I think he may even be an Order of Canada, Mr. Francisini, who's an incredible businessman in this community. I can name a whole bunch of others, and if that member wants to look Mr. Francisini in the eye and call him a bureaucrat, let him go right ahead, because that's what I heard him say, Mr. Speaker. It tells me he is as out of touch with health care as he was with rural issues when he represented the former constituency.
Mr. Speaker, the Minister and all Calgary MLAs were silent when the Super Board removed the green light laser equipment from the Calgary Rocky View Hospital. Does the Minister agree with the Super Board in its decision to remove the green light laser equipment from the Rocky View Hospital?
The Honourable Minister.
Mr. Speaker, that issue was taken care of a long time ago, and I think that was well before the member moved into Calgary-Glenmore, Mr. Speaker.
The Honourable Member.
Yes, Mr. Speaker, he needs to check out history. But the Minister has insulted the people of Calgary-Glenmore and all Calgarians by removing the green light laser equipment from the Rocky View Hospital. Does the Minister consider their health concerns, as he does their democratic decisions, as simply the flavour of the month?
The Honourable Minister.
Mr. Speaker, the Minister did no such thing. The particular piece of equipment that this member refers to was in the hospital on a trial. The company that had it in on a trial had determined that the trial had ended and had made a decision that they were going to remove it unless it was taken on full-time. That issue was resolved. To the best of my knowledge, it is continuing to operate. And so I'm not sure. I think the member should be a little more prepared about his own constituency if that's the kind of question he's going to ask, Mr. Speaker.